This show is brought to you by Kings Ridge Elderberry Farm. Visit tkrfarm.com. That's the Kings Ridge Farm, tkrfarm.com, and purchase your elderberry needs from the Kings Ridge Elderberries. Use code WB10, that's Waterbreak WB10, for 10% off of your first order. And as kind of a personal anecdote here, me and my wife have used this elderberry cocktail that they make. It's fantastic, and our kids love it. In fact, our kids are putting it in yogurt and all sorts of things. And we've had other flavors before that we've not liked, and the cocktail that they put together for their elderberry juice is fantastic. Go to tkrfarm.com and support them. Hey y'all, welcome to Waterbreak. It is good to be with you. This is the water boy Gabriel, and this is my wife Annie, the main knowledge of the show. We're very grateful for you tuning in and everything. This week, we actually got Dr. Tabitha Barber. I'm laughing because I got a nickname in the background going on in my mind. Joining us. She's also speaking at our Waterbreak Summit. We're very grateful to have her. We're very excited to have her come. She's an expert on women's hormones and other things that we're going to be discussing with her. And she'll be speaking at Waterbreak Summit. So if you guys have not signed up yet, hopefully this show will convince you to sign up. Go to waterbreak.tv to sign up to our summit. We hope to see you in March along with our other speakers. And we're doing a VIP dinner for those who want to kind of get a really nice dinner and hang out with our speakers before the summit starts Friday night. We'd love to see you there too. And you can click on and buy tickets, VIP tickets also, to join us for dinner before the summit starts and everything. So you want to we actually read Dr. Tabitha's whole bio and bring her in.
Yes. Yeah. All right, you guys. So excited to have Dr. Tabitha Barber with us today. She is a sought-after physician, speaker, and two-time best-selling author dedicated to helping women take charge of their health. Once a teenage mother and high school dropout, she rebuilt her life through faith and perseverance. She is a triple board certified obstetrics and in obstetrics and gynecology, menopause, and functional medicine, and provides virtual care to women nationwide, which is amazing. Through her international best-selling book, Fast to Faith, podcast programs, and supplement line, Dr. Tabitha teaches women to heal from within, supporting gut health, hormone balance, and spiritual wellness. So quite the accolades, Dr. Tabitha. We are very, very grateful that you're taking the time to be here with us. All the way from Michigan.
I am so excited for this conversation. Thank you for having me. We are going to bless so many people today.
I think so. I am so excited about this. And really, on that note, I just want to dive right in. We were just talking before we started recording that
my wife doesn't like small talk. She's just like, we're going.
He's always telling me that we need to small talk more. And I'm like, no, we're talking to these amazing people and we need to like wring as much information out as possible. Well, and I feel that way, especially on the topic of female hormones, because I feel like so many people are just really hungry for trustworthy information. And that's what we were just talking about this before we started recording. Like, I feel like over the past 20-ish years, it was radio silence. Like, no one knew about hormones. No one was talking about them. Doctors were just like, they'll give you cancer or it's part of getting older. And that's all you got, and a whole generation of women suffered. And now I feel like we're turning a corner and hormones are being talked about, which is fantastic. Doctors are starting to kind of wake up to this. Women are starting to wake up to this. But I think now it's just like chaos and confusion, and who do we believe, and what do we do, and what are these hormones, what are the symptoms of having them, not having them. And so I was hoping that we could today have a nice little masterclass on that and just cut through some of the confusion.
Yeah, let's do it. I think that would be awesome.
All right, let's do it. Let's start with this, and I want to focus on women, but you can tip over into men at any point if you'd like to. Why don't we just start with the main sex hormones that normally come to mind: estrogen, progesterone, testosterone. You can add some in there if you want to. Just give us a quick summary of what they are, why they're important, and what they do for us.
Okay, I would love that. So, we go through this cycle of puberty when we're an early teen, and our ovaries, which are kind of just laying dormant, not doing much, they come to life. I think of them as a factory. Like, the lights come on, the people come in, they start working, they start producing, and they're making estrogen. And the way they make estrogen, we have two parts of our cycle. The first half is our follicular phase. The second half is our luteal phase. Right down the middle is ovulation, where we release an egg that can potentially get fertilized and you become pregnant. So the whole idea is that estrogen rises during that first half to tell that lining inside the uterus to thicken and grow. In case the egg gets fertilized, then it has somewhere to implant. So estrogen is a growth hormone. That's what I want women to understand. It grows things. It grows the lining in your uterus, the fat on your hips, the fat on your breasts. And then after ovulation, progesterone and estrogen get produced from the ovary. And progesterone keeps that lining from getting too thick or overgrowing. It kind of keeps estrogen in check. So they're a good balance together. And if you don't get pregnant and implant an egg into that lining, then the hormones drop and you shed that lining, and that's what you bleed off as a period. You not only bleed blood, but you release that tissue that grew every month. And so we're supposed to go through this every month, and testosterone shoots in around that middle of the cycle. A few days before ovulation, it really starts to rise because it's our, drive hormone. It makes us want to be intimate so that we do get pregnant. Even if you don't want to get pregnant, your physiology wants to get pregnant. That's how God designed us.
Mm-hmm.
And so the testosterone rises, and then after ovulation, a few days later, it falls. And so that's why women aren't always in the mood. You know what I mean? Because that is a pulsatile hormone related to ovulation. So a lot of women feel bad about themselves or feel bad in their marriage because they don't have the same feelings that men do towards sex. And it's like, no, you're just created differently. So we need to honor that and work with that. I just wanted to throw that in there. But so these hormones, they should go on and function normally. Of course, they change during pregnancy. We have very high levels of progesterone and estriol, which is another form of estrogen during pregnancy. And then after pregnancy, they drop really low. And if you're breastfeeding, they might not be producing for months on end. And that's where we see a lot of postpartum depression and other mood disorders, because here's the truth of it. Estrogen is our happy hormone. It's our natural antidepressant hormone. It makes us happy and feels good. It gives us our personality. And progesterone is our natural anti-anxiety hormone. It keeps us calm. It prevents us from being overwhelmed or irritable. And progesterone is one of the first hormones to decline in perimenopause. And that is why women are saying things like, I've always been able to handle this. Why can't I handle it anymore? I'm overwhelmed. I'm just like biting my husband's head off. I can't stand his chewing. Like that is all a drop in progesterone. I know
that's been our whole life though.
No, you're right on the money. Like, can you just chew somewhere else? So true.
Yeah, you need to get her some progesterone. That's what's going on.
Oh my gosh.
That's funny.
That's great. That's great. Keep going. So,
so progesterone.
For those talk a little bit more about just in general, just walking around for women. You said estrogen is it's growth kind of hormone. Your vitality. It's your happiness. It's your femininity. Is that a good way of putting it?
Yeah, absolutely.
And then progesterone kind of counters that or balances it out. It's your anti-anxiety hormone. And you're right about that. You hear a lot of women when they get to that kind of perimenopausal time of life where they're more easily stressed, they're more anxious, they can't sleep as well. And it's all things that kind of fall in that same vein. What about testosterone? Where does that fall in? Because I know a lot of people think of testosterone as mainly a male hormone. So talk about that a little bit.
Yeah. So as we see progesterone start to decline and women aren't consistently ovulating every month, sometimes that testosterone starts to not be produced efficiently either. And what we have come to understand is that our adrenal glands, they're like little glands on top of our kidneys toward our back. They are our backup ovaries. They help produce our sex hormones in addition during the reproductive years. But after menopause, when our ovary factories close up shop and they're no longer producing these sex hormones, we rely on our adrenals for our sex hormones. So they make a little bit of testosterone. And so what we see for women is most women should be going through perimenopause with enough testosterone because their adrenals are also producing. But if they are stressed out to the max in this constant state of fight or flight, their adrenals are in overdrive or just burnt out, we see testosterone really decline much earlier than it should because we don't have that backup supply of testosterone. So, you know, most OBGYNs don't think that women need testosterone replacement because of this additional coverage. But the truth of it is the majority of women nowadays really are going into perimenopause with severe adrenal dysfunction. And we do need to be testing testosterone. I see so much low testosterone, like women who don't even have measurable levels. And here's the truth of it. It's not just for sex drive, it's drive for life. It's your get out of bed, get stuff done hormone. Like you want to go to the gym, you're not going to want to if you don't have any testosterone. And so it really is an important hormone for women.
I love hearing you say that. I am totally on the same page as you. And it is interesting right now. It seems like we have some sort of epidemic of low testosterone in men and women. Like it's just low in everybody. And I'm sure you're right that stress is a huge driver of that. Probably especially in women. We don't seem to tolerate stress as well. I don't know. Everybody has their breaking point, but women seem a little bit more sensitive to it. But everyone's low. I look at a lot of blood work too, and I'm in the gym setting and in a strength building setting. So I'm always looking at people's free and total testosterone. And I can't remember the last time I saw a middle-aged woman who was above. I mean, they're just so low. It's crazy. And I'm really happy to hear you talk about it. It's not just about libido and sex drive, although that is really helpful too. I mean, it's not nothing, but yeah, I mean, it is your get up and go hormone. And I think a lot of people, they can't put the right words on it, but they're just like, I just don't want to. I just don't want to. Like, I just don't have that motivation anymore. I don't have that drive anymore. And we really need that for life. And of course, just to get yourself to the gym, to lift the weights, you're supposed to lift, to eat the way you need to eat, so, and I've actually looked at several studies showing that it can be protective of bone. It can be protective of the brain. Have you seen some of that?
Yeah, absolutely. And the biggest thing that women can benefit from is not only like it helps with brain fog. It really does. It makes your mind so much clearer, and your bone health stronger. But it keeps your muscle mass there. It keeps your ability to gain muscle while you're working out in the gym. And that's really important because muscle regulates your blood sugar. And we know that once you go into menopause, your risk of diabetes starts to increase. And that's something we could talk about if you want. But one of the biggest things is I watch them, they're going to the gym without their hormones and they can't make any gains with their muscle. They're having joint pain and fatigue because they have no estrogen. And so they just quit going to the gym altogether. They quit moving their bodies. And that is a recipe for disaster. That is the quickest way to have a bone fracture and increase your morbidity and mortality. So all of this stuff is really impactful and it's all connected. It's not just about libido and your looks and your weight and feeling good. It's like your function and your ability to live.
I like where the conversation started, talking about hormones as it relates to us being created in the image of God and how God created women particularly, and how the hormones kind of complement that creation, or maybe not even the word compliment's good, but kind of double down on the nature of how God created women. Like every month they get a reminder that their bodies are for making babies.
Yeah.
But one of the things, just watching my wife's kind of health journey over the last probably 6 years, I think is when it was, and my wife kind of went through the whole thyroid thing. Like her thyroid wasn't functioning well, and she kind of went through all that. And then she's just kind of gone through a number of almost self-discovery ways of fixing some of the challenges that that she's going through, and then kind of, I'd say, I don't know, this last year your testosterone was low.
Yep.
And then you started, and then I'm like, to me as a dumb man, as a man, I'm like, why do you need to fix? Why? Big deal if your testosterone's low, you don't really need it, kind of thing. I need it. Dad, man needs it.
Give it to me.
You freaking yeah. And so, and of course, women's testosterone levels, I think, are obviously, multiple times lower than men's.
Right.
So it's not even, again, we're mated male and female in the image of God. So maybe walk us through a little bit, like, on women's testosterone levels, at what level, what's the regular, maybe healthy level it should be at, and then why is it bad for you for women having low testosterone levels?
Yeah. Oh my gosh. I love where you were going with that for a little bit, and how we ingrain it in little girls' brains that our periods are just a nuisance. We should get rid of them if we can. It's not something to honor or be proud of. It's something that we should be ashamed of. And, we just put everybody on birth control to try and get rid of these periods and any sign of us being females and feminine. And that breaks my heart. And we are in a spiritual warfare in this time in history, because we are now seeing that men have too much estrogen and not enough testosterone, just like women. And so it's really blurring the lines of who we are distinctively and how we're supposed to be feeling. We see men with man boobs, and a lot of this is driven by all of the chemicals that we've created over the past 70 years in the lab. We have more than 10,000 chemicals that did not exist 70 years ago. And so these plastics that you see everywhere, I'm sure if you look around, you're just like, it's all plastic. And those are forever chemicals. They are endocrine disruptors. They attach to our estrogen receptors and send these warped signals. And so we're seeing infertility at sky high rates, and men with weight gain like women, and more mood disorders than men ever had, and significantly low testosterone. And it's an epidemic at this point. It really is. And I want to encourage people to keep asking questions and fighting for answers, because the mainstream conventional doctors are still saying, we can't test hormones. They fluctuate too much. It's something that we don't really understand or can't, fix. And that's not true at all. We're just, our conventional medical system is set up for acute care. It's set up for a broken leg to, help you in a car accident, life and death situation, ruptured appendix. It was not created to handle this lifestyle diseases that we have created, unfortunately, in our society. So all these hormone disruptions, diabetes, heart disease, cancers, these are like things that we are making happen, unfortunately, as a society. And I was talking with somebody about this yesterday in another podcast. When I went to medical school, I was taught that perimenopause is a 1 to 2 year transition before full menopause. Menopause is 12 months without periods because your estrogen dropped. And amazing. Now the word perimenopause is all the rage. Everyone's talking about it. And they're saying it's this 10 to 15 year experience of hormonal disruption. And they're acting like this is just how our bodies are. And it's not true. Our ancestors did not struggle like this. This is not how God created our bodies. This is the mess that we are making as a society. So this 10 to 15 year hormonal imbalance that men and women are struggling through, it is from our diet. It is from the high toxic burden in our daily lives. It is from the traumas that we're not dealing with and the lifestyles that our great grandmother and grandfathers never lived. Like when I'm 50, I'm going to be 51 next week. my grandma was not running 3 businesses with 2 teenagers traveling across the country at this age. She was like serving dinner on Sundays and knitting, and really chilled at this point. And so we're living at a time that we never have, and we're acting like this is just, our bodies are meant to fall apart and be a hormonal mess. And that's just not true. We're doing this, and we need to take a step back and say, how can I start to listen to my body, honor my body, respect it, remove what's ticking it off, give it what it needs? And so that is why I wrote my book. It was essentially everything I learned through studying functional medicine and anti-aging medicine, of like, all these symptoms we're struggling with are just messages. Your body's trying to tell you something. We need to start to learn to hear what it is saying to us and then respect that. And that's what we're not teaching our children. That's definitely not what I learned growing up in the 70s and 80s, So we just need to shift the conversations.
Yeah. So my follow-up question then is, basically for women, because I think especially as it regards to testosterone, I think there's a lot of just kind of not paying attention to this for women, but like, at what level should women's testosterone should be at what level? And then what's the problems they're probably experiencing if they have low testosterone levels?
Okay. Yeah. So it does depend on when you get your blood work drawn, what your levels are, because remember that does go up during the month and then there's a few days where it's down lower. So I like to capture it around ovulation, or at least a few days after that. So I do most of my blood work days 18 to 22, so I can also get a high progesterone level, because that's right. Peaks. And when you look at testosterone, you want to look at a few things. There's a total testosterone level. There's a free testosterone, meaning how much is available in your blood to attach to a cell receptor and send a signal. And then there's something called SHBG, or sex hormone binding globulin. And that's a protein our liver makes that helps carry testosterone around and other hormones. And it depends on how much of that carrier protein you have, because sometimes all your hormone is like bound up in this protein and you don't have any free available to even use. And this can really become challenging for women, especially who do pellet hormone replacement, because when we give pellets, they go under the skin. They're little implanted things that we do. We give supraphysiologic levels. So we give really high doses so that they can feel the effects, and it will slowly release over 3 to 4 month time period. But what happens is that drives the sex hormone binding globulin to go high, and you produce more of this binder. And so you have less free available. So women will often feel good the first few pellet doses, and then they just don't feel it anymore. And they need more and more doses because this SHBG continues to rise along with it. So that really is an important piece of the puzzle, because I've had people come to me and they're like, well, my doctor gave me testosterone and I just didn't feel anything. So I don't think it's for me. I don't think I need it. And it was because their SHBG was really high from prediabetes or insulin resistance or having been on pellets or something like that. So I always tell women, you want to go to someone who really understands the intricacies of all of this. And you mentioned having a thyroid issue. That also impacts this, because there's something called thyroid binding globulin that carries thyroid hormone around our body. And that can go up and down depending on our sex hormone levels. So literally it's all connected. And if your provider isn't looking at all the pieces of the puzzle, the picture will look distorted and incomplete.
Right. I'm glad you brought up pellets. I have a really hard time thinking that pellets are a good idea almost ever. I do know a few women who happen to feel good on them, because I don't know why, but just for our audience, a pellet will take you. I mean, I've seen women with a testosterone of 400 or 500 at the start, and then it slowly peters off. over the, I don't know how many months, and then you get a new one. And the heart, I mean, that's really high. That's
so
really
pellets
crazy.
like one peel that's supposed to last for like 6 months or something?
Yeah, they literally insert it in kind of like the top of your butt, kind of.
Really?
Yeah, under skin in your subcutaneous layer. And
yeah,
I have a few women who do them, and they both, the two I'm thinking of right now, one is a diabetic who's uncontrolled and the other has prediabetes. So they naturally have this elevated SHBG because of their insulin resistance. And so other forms of testosterone just aren't touching them. They need that high dose. And so they love their pellets. But the majority of women, they have hair loss on their head, or they have acne on the chin line, or chin hairs growing.
You can't go back. That's the problem.
Right.
Like if you're doing a cream or an injection, you can adjust the dose based off of how sensitive you are to it, because those are really the biggest side effects would be I'm losing hair, or I have hair where I don't want it, or my skin is oily. It's not the end of the world, but it's not very fun. But you could just be like, oh, I'll bring my dose back with a pellet. You're kind of screwed.
Yeah, we cannot take it out.
Sorry. Enjoy the next 6 months of your life. So yeah, I'm glad that you brought that up. But
yeah, and Gabe asked like a specific number. So, you know, I try to shoot for the high normal when it comes to blood work. So maybe a total testosterone of 30 to 45, somewhere in there. But I am telling you, every woman is so individualized. I'll have women, their free goes from like 0.5 to 1, and they feel like a new woman. And then some women, they go from 0.5 to 2, and they're like, yeah, I'm not really feeling it, because their total didn't move. So you do have to incorporate that clinical piece of, are they feeling different? Are they gaining muscle in the gym? Like, are they feeling the effects of it? So I don't just strictly go by numbers.
Yeah, that's a really good point. People are all over the map. I feel really good when replacing it a little bit higher, but like for me, if my testosterone is at like 100, just for reference, a young dude would be at like 1,000. Like we're still talking completely different reference ranges.
Yeah, exponentially different.
Totally
different world.
But so it's Goldilocks, I think, like a lot of hormones. But I think it's really great that we're talking about it, because women do need it, and I think doctors do miss this. And when you tell them, hey, just go to the gym, build some muscle, which you really need to be able to manage insulin and glucose, like you already said, it's really hard for them to want to get up, to have the energy to get up, and then what's even worse is when you make yourself go and you put in all this time and you have nothing to show for it. It's a really important hormone for that.
And I guess it's I'm asking the question because obviously I'm not a woman, I don't know, but like, what negative things are happening when a woman's testosterone's low? Like, what are you guys experiencing?
I'll let the doctor talk about it.
Complaint I hear is I just don't want to participate in life anymore. They're just not interested. There's no desire to get out of bed and do stuff. There's no desire to like hang out with their friends or their husband anymore. It's just, they feel really flat and like a shell of themselves. Some women will say, I'm just a shell, or I'm not me anymore. And you give them that testosterone and they just come back to life. It's really amazing, actually.
It is pretty,
I will say it's a challenge as a provider to give testosterone, because number one, they don't make standard prescription in female doses. They only make it for men. And so we have to use compounded prescriptions, and not all compounding pharmacies are created equal. And so they can't all be trusted. And it's a controlled substance. So I have to have a DEA license to prescribe testosterone, thanks to the bodybuilders back in the 1980s.
Thanks, guys.
Ruining it for everybody. So there's a lot of hurdles for women to actually get testosterone. I hope that changes soon.
Yeah, I remember, I think when you first started getting it, it was expensive for her. And I was like, why don't we just buy it for me and then you can take it?
Right. Well, some doctors go that way, but then you have to figure out what is 1/10 of the dose of this. You know, it's just hard. It's hard. It's hard all around. And I agree. I know a lot of people are on the warpath trying to get this FDA approved for women. It's crazy. It's really crazy to me. And I will just also mention, you mentioned this before, but the brain fog, the mental acuity that you get when you get your testosterone into an optimal range is crazy. And brain fog is, I mean, I would say for perimenopausal women, weight gain or just the, weight that issues that just weren't the case before, but are the case now. That's one of the number one complaints. Low libido is a huge complaint. Brain fog is up there. Like it comes up all the time where women are just like, I feel stupid. Like, I don't know what happened. I walk in a room. I don't remember why I walked in there. I can't remember basic words. And that is the most frustrating place to be, especially when you're in a situation of life where you really need your brain firing on all cylinders. It's super frustrating. And a lot of the hard thing about brain fog is that it could be coming from there's a lot of different things that can cause it. But I always say you better look at that testosterone because that makes a huge difference. It makes a huge difference. So it's not.
It does. And it's no joke because women at our age, a lot of them have been in the corporate world and they've spent 20 years getting to a certain level in their job or their position. And now it's being threatened because they can't perform to the same level anymore. They can't even complete a sentence or finish a project. And it's heartbreaking, It's like men would never put up with that, not for a second.
No, they'd be like, fix this, fix it. But for women, it's just part of getting older. Sorry. And that's just it's silly. That's why we're here. That's why we're talking to you. Well, let's pivot a little bit. And let's talk about the elephant in the room, hormone replacement. Can you talk to us about it? Is it safe? Should we be doing it? Maybe talk about what happened.
What is it? I'd love to know, what is it?
Gabe wants to know, what is it? Yeah. What is bioidentical hormone replacement? And maybe talk about the Women's Health Initiative here a little bit also.
Yeah, I would love to. So as I mentioned, the ovaries are like factories. They produce these hormones all day, every day. And once we kind of run out of viable eggs, the factory decides it's going to close up and not produce anymore. And so we get to a point where we're no longer making estrogen, progesterone, and testosterone. The ovaries, they shrivel up, actually. Like as a surgeon, if I would go into a menopausal pelvis, they would be the size of almonds, where as a reproductive woman, it's more like a clementine. And so the factory closes, they're done. And you have two options as a woman. You can either embrace this change in who you are and figure out how to function without those sex hormones at the levels that they've been at, or you can try to replace them. And that is what hormone replacement therapy is. It's taking the hormones that your body is no longer producing. And it's not a crazy concept. It's literally what we do for the thyroid and for the pancreas. So diabetics don't make insulin. We give them insulin. It's a growth hormone. Thyroid doesn't make thyroid hormone. We give you thyroid hormone in the form of T4 or T3, levothyroxine or liothyronine. And so we give you estrogen, progesterone, and testosterone, sometimes all three, sometimes just one in different combinations. And when I counsel women, what I talk to them about is that there's two reasons to take it. The first reason is that you're super symptomatic and you're miserable. Like you're having hot flashes all day. You're not sleeping at night. You're having so much joint pain. You don't want to work out anymore, that type of stuff. The other reason is the research does show that without those sex hormones, our risk of lifestyle diseases goes up. Diabetes, heart disease, bone loss, osteoporosis, dementia. Women have way more dementia than men because of loss of estrogen. Estrogen is super protective throughout our body. It keeps our arteries pliant and like mobile and elastic so that we can push the blood through our body. And when the estrogen goes away, our arteries become hardened and stiff like pipes. And we see our blood pressure go up. We see our cholesterol go up. All these things shift when the estrogen goes down. And so you can take it to slow down those risk factors of those diseases developing. And that is a conversation that I believe every woman deserves. Unfortunately, not every provider is equipped to give that conversation. So that's where the struggle really comes in. And honestly, I was blessed to inherit when I took my job in the current town I'm in 10 years ago. I inherited a medical practice from an older gentleman that was retiring at 74. He practiced until he was 74.
Yeah.
Wow.
And
wonderful.
yeah, his patients, like he delivered their babies and took them through menopause. And so I inherited all these lovely women in their 70s and 80s, and they were all on hormones. And this was after the WHI, when people were supposed to be scared of hormones. And so they threatened me. They were like, you're going to keep prescribing. You're not taking away my hormones. I want to have sex and play pickleball. And that's how I do it. And so I learned so much from these women of like, oh my gosh, I don't have to be afraid of hormones. It's keeping them young. I would look at those patients and then the ones who weren't on hormones, and it was a night and day difference. I remember one woman, they took her hormones away, her primary care did, and she ended up having a stroke like 2 weeks later because of the abrupt removal of estrogen in her 70s. And I was like, it really does matter. And so I'm grateful for that practice because I just learned so much from them. And I learned that your hormones make you who you are. We don't have to be afraid of them. We just have to be smart about it. And what the WHI really did teach us is that estrogen doesn't cause cancer. It's synthetic progestins that are the culprit. So they are supposed to mimic progesterone, our natural hormone. And they do that to the uterus, like they stop the uterine lining from overgrowing fine, but progestins don't act the same way in the rest of our body. And they have been the culprit for cancer this whole time. And the saddest part, you guys, is that is what is in birth control pills and IUDs are progestins. And so we are telling women to take these like liberally for 20 to 40 years nonstop. And then at 50, we're like, oh my gosh, you can't take hormones in a tenth of a dose because it will cause cancer. No, what you just took for 20 to 40 years, that's what caused the cancer. And so we've lost all common sense. We're not even looking at things correctly. And it's because for decades, there wasn't a sparsing out of exactly what hormones were being tested or used. They just lumped everything together and called it a progestogen. And so what we've learned is that there is a smart way to do hormone replacement therapy that's actually beneficial and keeps you healthy and vibrant, and it doesn't cause cancer. So
that was a fantastic summary of all of that. Thank you for that. The WHI really, that's the Women's Health Initiative. That's the study she was referencing. And it really set us back. Even though, if I'm not mistaken, the authors came out and actually said, we did not interpret that very well. And this is, and it just seems like the damage was done, or I don't know, maybe doctors are like, I've been saying it's dangerous for years. I'm not going back. Like I can't go back. I don't know. But
I'm sorry, I don't mean to interrupt, but not only did they say, oops, they said we purposefully created that study to prove that hormones were dangerous. So when there was 2 more cases of breast cancer out of a 10,000 group of women, they halted the study early, gave it to the media. The media went wild and said estrogen causes cancer. It wasn't even the estrogen only arm. It was the estrogen and progestin group. And it was an extra 2 out of 10,000 women. So they had an agenda and they really accomplished it. It's disgusting. So really if anyone wants to read about these studies, the book Estrogen Matters is incredible. It will break down all the studies and help you understand that you don't have to be afraid of estrogen. There was a huge agenda behind that.
So that WHI report basically became the foundation for why everyone needs to be very nervous of hormones.
Yeah, like estrogen gives you cancer. Don't get off. Women just got off hormones overnight, right? Doctors were like, you have to get off of them.
Or you're going to get cancer.
In absolute panic. Yeah, or you'll get cancer.
My goodness.
Right. So, and I almost think that's worse to be on them with, nice high levels and then just stop. That's so traumatic to a body. I mean, she just referenced a patient or someone that had a stroke 2 weeks later. I can't believe more doctors went along with that because it didn't make a lot of sense. But anyways, I'm glad that we're here now, having this conversation. So in the small amount of time we have left, can we talk a little bit more about HRT, hormone replacement therapy? I think there's a lot of confusion about
we got this is the last question. So
okay,
like 3 minutes.
When women should start it? Is it ever too late? Because, what if it's my mom who's been in menopause for years and she's finally hearing this message and she's like, oh, well, I want that. I want to feel better. Should we be starting women really early, kind of preventatively, for all the benefits you just talked about? What is your opinion on that?
Yeah, so the research is pretty clear that if you want to start it, you should start it within 7 to 10 years, because once those disease processes set in of heart disease and diabetes, you can't really reverse it by going on estrogen or progesterone, but you can prevent it if you go on it before those disease processes happen. So, if you're a few years out from menopause, yes, have that conversation. Consider using systemic hormone therapy. And that means like it goes throughout your body and affects your whole body. For women past that, if they've already, they're dealing with heart disease and bone loss, osteoporosis, there might still be a conversation for systemic use. They're just not they have to understand the limitations of the benefits. But there's also local hormone therapy for the vagina and the bladder. And that can be huge for postmenopausal women because those things creep up on you about 10 or 15 years after menopause, to the point where you have to give up having intercourse because it's so painful. You're having chronic bladder leakage. You can even have a prolapse where the organs start to fall through the vagina, and that can cause issues not emptying your bladder or your bowels. It can be very uncomfortable. So there's a lot of quote unquote embarrassing things that can happen, but local hormone therapy vaginally can really help with that stuff. So there's always room for those conversations to keep happening.
That's fantastic. It's such a bummer to me that our standard docs weren't trained in this, just because 50% of their patients, I would even argue more, because I think more women go to the doctor than men, but just so many of their patients are women. And then, perimenopause can be anywhere from your mid 30s all the way through to what is the average age of hitting menopause? 51, 52 on average. That's a really long time. And then of course, hormonal care past it. It's sad to me that they don't know about this, but I'm glad that there's doctors like you who they could at least refer out to. It sounds like you do telehealth. Is that correct?
I do. I'm licensed in over half the country, and you just reminded
me
of something.
In Idaho?
I believe so. Yeah, let me look. I have to look at my list. I don't have it memorized, but
I hope you are. It's a painful process, I've been told, to just individually get licensed in all the different states. It's a pain that you guys have
I am licensed in Idaho, yes.
Hey, guys, that is awesome.
But here's the truth of it. OBGYNs, who are quote unquote women's health experts, that's who we go to for these problems.
Right.
We are surgeons. I spent 4 years doing a surgical residency, cutting people, doing a hysterectomy 4 different ways, doing C-sections and vaginal deliveries and procedures in the office. So unfortunately, we think they're women's health experts, but when it comes to hormones, we do not learn this in medical school or residency. So It's like, you can't even be mad at the OBGYNs. They're doing their best, but they really are not trained in these intricacies and understanding that the adrenals affect the hormones and the thyroid and the gut and the immune system. So that's why I wrote the book. And I think every woman should read it so they can understand what the heck their body's trying to say to them and how it's all connected, because we're just looking to the wrong people for answers, but the answers are out there. I promise you, they really are.
That is fantastic. Remind us the title of your book, Dr. Tabitha.
Fast to Faith.
Fast to Faith. And people can find it anywhere, Amazon?
Yep.
Okay. That is awesome. You also referenced the book Estrogen Matters, which I have read. It is a phenomenal book, especially because estrogen really is kind of a hot topic.
And maybe Dr. Tabitha, you can bring a couple signed books to give away to our audience at the
do it.
Oh,
summit,
absolutely.
if you want to.
Do it.
I should maybe ask you offline, but I'm putting you in a position where you can't say no.
Yes, that's what Gabe's best at. This is where he shines. Yes.
I love
okay.
it.
Well, and if one of our listeners is listening and they're like, I want to work with you, I need help. I know I need help, and I want to work with someone who really knows what they're doing in the hormone department. Where do they go to actually possibly work with you as a patient?
Yeah, so my medical practice is through drtabatha.com. It's DRTABATHA, 3 A's, no I. My mom spelled it wrong. But that is where you can find the medical practice and connect with my team and see if we can help you.
Amazing.
Well, thank you so much, Dr. Tabitha. We look forward to seeing you here in March at the Waterbreak Summit. We
I can't wait.
If you guys
we're so excited.
Want to be in a conversation with us, make sure you email us at RenchMedia@gmail.com. That's Rench, RENCH media@gmail.com. And of course, sign up to see Dr. Tabitha at our Waterbreak Summit, March 27th, 28th. Go to Waterbreak TV, waterbreak.tv to sign up. Click on Summit and it'll get you all the landing page details and everything. And if you want to sponsor or booth at our conference, also reach out there. You can sign up there or email us at RenchMedia@gmail.com. Everything. You guys have any questions for Dr. Tabitha that we didn't answer, email us those questions too, and we'll see what we can do for our next show or one of our Ask Me Anything kind of shows that we got coming up. So again, Dr. Tabitha, find her book on Amazon, go to drtabatha.com if you guys want to check more out with her practice and what she's doing there. But thank you guys for joining Waterbreak, and we'll see you next week.
Bye, guys.